What does the Health Ombudsman's report mean to those who lost family members? What can be made of the resignation of former Gauteng Health MEC Qedani Mahlangu? Why did Gauteng Health Department terminate its contract with Life Esidimeni? Why did the department fail to handle the relocation process with the sensitivity it deserved? What time is it? It's question time. Hello and welcome to the show. My name is Rosalia Whitehead, standing in for Port Sedu. The much-awaited report on the deaths of psychiatric patients from Life Healthcare Esidimeni in Randfontein was released by Health Ombudsman Professor Malegapuru Makgoba today. The report reveals that 94 mentally ill patients died between the 23rd of March and 19 December 2016, while the Gauteng Health Department had initially said only 36 lives were lost. A number of civil society groups had warned the department about the shortcomings of the relocation, but their calls were apparently not heeded. In a twist of events, the Gauteng Health MEC, who presided over the relocation process, Qedani Mahlangu, has resigned. Mahlangu tendered her resignation only a few hours before the release of the damning report. We are live, therefore you can call us and air your views on the following numbers: 089 110 4210, or tweet us your comments. Our Twitter handle is @QuestionTime24. My guest, Dr. Mvuiso Talata, the immediate past president at the South African Society of Psychiatrists, SASOP, and Ms. Sasha Stevenson from Section 27, and she's an attorney there. Before we get into the discussion, let's have a look at this clip by the Health Ombudsman.
I believe that a combination of negligence, reckless decisions and actions, combined with appalling conditions in some of the NGOs, as revealed through the evidence of the different stakeholders, through the expert panels, through the inspectors of the Office of Health Standards, and through the interviews that I've held, have revealed that there has been excess and unnecessary but preventable death for some of the diseases that have occurred.
So we've just had the reports coming out today. Are you happy with some of the findings? Let's start with you, Dr. Talata.
Well, overall, I'm happy with the report. I think it touched on a lot of things that we predicted would happen when we contacted the Department of Health months before the announcement was made. So I'm happy with the report.
And Sasha, for you, are you happy with this report?
Yes, it's quite clear that the Ombud was very thorough in his investigation, and that's really important, and that he's come to findings and recommendations that are bold as is necessary when we've had a crisis of these proportions. So I think it's a really important report. The findings and recommendations are good, they're strong, and we're going to be looking at it more closely to see what the next steps are.
Dr. Talatala, do you think families will find closure after this report? Do you think it hit the right mark?
I'm still in shock myself. So it's a bit difficult for me to speak for the family. It's been a journey. We had anticipated that there could be such consequences, but you know, when you are predicting these things, you don't put a number. When you hear of 94 deaths, then it's something else. Even to people like us, we have not actually lost our own family members. It must be worse for the families. I think they will find closure, but it will take some time.
And today we just heard that Gauteng Health MEC Qedani Mahlangu has resigned. Is this the outcome that you were hoping for?
Oh, well, I did not wish for anyone to die or anyone to even lose his or her job. When we predicted, we just wanted to work on the process of these discharges, if they were necessary at all, and negotiate with the department. That is what they didn't do. I think, to comment on her resignation, I think it's very late in the process. I mean, if she had resigned when we heard of it, I'm shocked that we continued to have people dying after we heard of 36. If she had resigned when 36 people had died, then that would have been better. I think it's very late, but that's my opinion. It's for the families to decide.
Sasha, for you, is the Gauteng Health MEC's resignation a good outcome? And are you expecting any more resignations after this report?
I think it's an appropriate outcome. I think what it says is that the MEC recognizes that she is responsible, partly responsible for what has happened here, contrary to her statement today, but I think the actions are speaking, and I think it's appropriate that she's taken that action. It's certainly not enough. There's a lot more accountability that will be required to do justice to the people who have lost their family members, and also to the people who are surviving former residents of Life Esidimeni who remain in these facilities. So I think the accountability isn't over. It's not over for the MEC and for other officials as well who were also implicated in the report.
Okay, we've got Sunny on the line. Welcome, Sunny. What is your question or comment?
Madam, good afternoon. This is Simon. I'm calling from Val, and then mine is going to be very short. Perhaps I need to put this in a question form to say we acknowledge the fact that Ms. Qedani Mahlangu has just resigned. But I must say that this is just the tip of the iceberg. If they want to drill down and understand the depth of the problem, they must also come here in Val and come and audit all these NGOs and see what is happening there. But what I find bizarre, though, is why is the minister, Mr. Aaron Motsoaledi, himself exonerated from this problem? Because this is a clear massacre. A clear massacre by the very government that is supposed to be protecting our own mothers and fathers. Thank you very much.
Thank you, Simon. Would you like to take that one on, Sasha?
I think Simon raises an important point, and that is that the mental health system around the country is fatally flawed. We have a system in which mental health care users aren't cared for in the way that they should be. And one of the important recommendations of the Ombud was that there must be an investigation into potential human rights violations perpetrated against mental health care service users around the country. And that's really a recommendation that we support. It's been a long time coming. So I think that's an important point. On the issue of the minister, I think what we need to bear in mind is that provision of mental health care services at a provincial level is a provincial competence. So the decisions were taken by the MEC together with her team. And it's for that reason that the focus is on the MEC. When he found out about what had happened, the Minister of Health referred the case to the Health Ombud. And so that's the reason why the focus is on the MEC rather than on the minister, and I think appropriately so.
Okay, but do you think that should be changed? I mean, especially with this outcome?
I think it's something that should be considered, whether it would be possible to have more national involvement where there are particularly vulnerable patients, such as in mental health. That's an issue that I suppose we need to consider going forward, whether the National Department can get more involved in mental health care services to ensure the protection of vulnerable users.
Dr. Talatale?
I think, I mean, obviously the law says that it's the province that's supposed to be in charge of the mental health care services. But I like the question because after this incident, we actually need to look at other role players that should take some more responsibility. Firstly, I think the government, I hope they've learned from this, that when the professionals are speaking, they should be listened to. We want the government, as the Society of Psychiatrists, we didn't have a material interest in the matter. We are beyond looking after our patients. We want the government, but we're not even given an ear to be listened to. But further, I think the Health Professions Council and the health professions in general, doctors and other professionals, I think they should start questioning themselves, because if patients are going to be discharged in an institution, there must have been professionals involved there. What are their ethics? Could they not stand against the government? Where were they when we were trying to speak to the media? Did they have enough voice themselves to speak? I'm not saying that some of them, they did speak with us, but they didn't have, I found that they don't have enough voice to speak to government and say these patients should not be discharged. So I think that voice of professionals, not just the society, the professionals that are treating the patients, whether they're dealing with government or they're dealing with medical aids, that voice should be strengthened.
But is it a case of not being able to approach the MEC or even the minister?
There will be a comment, for instance, that if you're a government employee, you cannot speak to the media. Therefore,
Okay.
if we are then a doctor looking after those patients, or you're a doctor working at Baragwanath Hospital who's supposed to send those patients, you cannot just speak to the media about those issues. I'm not saying that people should be running to the media, but they should be able to say, no, we can't discharge these patients because it's unethical.
All right, Sasha, you'd like to say something?
I think one of the important things that came out of the Ombuds investigation was that there was a culture of fear at the Gauteng Department of Health, where people, not just psychiatrists caring for individual patients, but also officials within the department were afraid to stand up. And that's hugely problematic in a health system. We need our professionals to be able to stand up for their patients. It's an obligation that they have, and it shows a systemic problem within the department that really needs to be remedied.
Yeah, and so advocacy becomes, an outlet for these medical professions to perhaps, come back to an advocacy group such as yourself. And so you were part of a group that tried to speak to the Gauteng provincial government about this. Can you just take us through some of the discussions that you had?
Well, Section 27 first became involved in this matter in November 2015 when the South African Depression and Anxiety Group, the South African Society of Psychiatrists and South African Federation of Mental Health approached us and said that there had been this announcement by the MEC in October of 2015 that the Life Esidimeni contract was going to be terminated and everybody was going to be moved out. And from that point we started representing as lawyers those parties. We also met with a number of family members of people who were going to be moved out of Life Esidimeni, and we represented them legally as well. We went to court for the first time in December 2015, litigating against the department because it was quite clear that the plans that they had laid for this process weren't going to work and were going to result in rights violations. We got a settlement agreement then. The department didn't comply with it. We went back to court in March about the transfer of 50 patients to Takalani NGO, an NGO at which 12 patients, it turns out, has now died. The department said everything would be fine if they went to Takalani NGO. We continued negotiating with the department. We then, at the end of June, all of the patients were moved out. And in September, it became clear that patients were dying, and we raised that again with the MEC, and you know what happened from there.
Please keep that thought. Makgoba, we come back to you after the break. Don't go away.
It takes patience and the finest ingredients to craft a milk stout of superior quality that is made to be savored by the most refined palate. Castle Milk Stout. Savor the moment. The Castle Milk Stout 440ml can, now with a wider mouth for a smoother pour.
The only way to pour the perfect beer, this professional barman would tell you, is into a glass tilted at exactly 45 degrees. Oh, bless you. Bless you, sir. Bless you again. Well, we'd say the perfect way to pour a beer is at this angle, straight into your mouth. Get a 12-pack of Castle Light Handies for only $94.99 from Tops at Spar.
Welcome back. You're still watching Question Time. You can call us and air your views. The numbers to dial are 089-110-4210. And on the line we have Makgoba from Musina. Welcome, Makgoba. Please go ahead with your question or comment. Makgoba, are you still on the line? Okay, it seems like we have lost Makgoba. Dr. Talata, I just want us to discuss or go back to the issue because you were also part of the group that went to the health department to discuss this issue. I mean, do you think that you could have approached this difference and in any way influence the outcome?
I don't know that we could have done any better. Remember, once we were part of the team, we were told by the head of health that they would not want to negotiate with SASO. This was after the court agreement that we would all participate and negotiate. He told us out. I was even in a meeting where I had to force myself to stay in that meeting. So they were not prepared to stay with us, which makes me, there's a question that is not answered. What were the real reasons for closing Life Esidimeni? Because it's not financial. The report shows us now that it was not financial. So it's not part of the policy. It doesn't fit within the policy that we know. Otherwise, if it did fit, we would have been part of the process. So what were the real reasons? Maybe we'll find out one day.
So when you said it wasn't financial, because it was indicated that the Health MEC wanted to get it down to 100 Rand per day for the patients.
Well, you cannot run patients that are on medication food and are placed in somewhere at a budget of 100 Rands a day. That's most of the medications are 500-600 Rands a month, just medications only. We haven't touched food, their own healthcare, so that budget will be below. But also, remember, some of these patients were in government institutions such as Randfontein, Vescopis before, or Helen Joseph or Paraguanath, before they went to these facilities. Where we now see, because these figures are always hidden to us, that at Randfontein is almost over 1,300 to keep a patient per day, and at Vescopis is 1,900. So Life Esidimeni was way cheaper than that per day. These are fees paid per day. Obviously, I understand why it would cost so much because you are talking of medications, the nursing and all of that. What we're going to have now is that those patients are going to be moved back to those facilities that are even more expensive. It's actually counter the institutionalization, if there's such a word. It's actually working backwards. We're going to be worse off than we were in 2015.
Okay, we've got a Spongile on the line. Welcome. Please go ahead with your question or comment.
Good
afternoon, Spongile.
Good afternoon. I'd like to comment regarding this thing of the department not listening to the doctors. This thing, in my view, because I'm one of the professional people, this thing, in my view, it starts at the hospital level, where professionals themselves, they don't respect each other. And professionally, you are supposed to advocate for a patient. But sometimes if you advocate for a patient, you are told that maybe as a radiographer, I want to advocate something to the doctor. Then that doctor will tell me that, who are you? I didn't see you as a medical school. I didn't see you in Medunza. Who are you to tell me? Certainly, I think this thing still on the hospital level. This thing of CEOs that are not medical professionals. Sometimes we find that in the budget meetings, when you put your input as a health professional, as a medical orientated person, the budget you are told for just a simple thing, maybe for gloves. The CEO will prioritize laptops, fancy laptops, and all those things compared to basic things like gloves and all those things. So in my view, before we go to the MECs and the ministers, these things, they start at the bottom, at the hospital level, where no one is listening to the other one, the other one is not respecting the other one.
Thanks so much, Spongile. Thank you for your comment. Sasha, I just want to go back to you regarding the report today. I mean, some of the or the families were told to go and speak to the department as well as the Premier. Are you privy to what was discussed during this session?
Yes, the Premier wanted to speak with the families to assure them that he was going to take this matter seriously, and that he was going to further investigate, take steps regarding the MEC's replacement, and that he would be there to support and engage with the families. And I think that's very much appreciated. The families have had a very, very difficult time over the last year and a half.
Yes.
Apart from the deaths of their loved ones, they started trying desperately to engage with the department very early on in this process, very reasonably and soberly. They went out of their way to engage before having to resort to litigation. It was only at the very last stage that they decided to litigate on this matter, and unfortunately had to do so twice. So, you know, it's really important that there is now some semblance of responsive governance here, and we trust that it'll continue, and that the Premier and the Minister of Health will continue to work with the families to come up with a solution that works for their loved ones and for the mental health care service users generally in the country.
Okay, Dr. Tala, I mean, are you hopeful that the Department of Health as well as the Premier will really stick by what has come out of this report?
I've been disappointed so much that I will have to watch them closely in the way, in the manner in which the report is written, and the way the Premier and the Minister of Health have responded. It's reassuring. But I would not just go and sleep and not work with patient families and partners so that we monitor that all is implemented. Just to add something not in your question, you know, we've got mental health review boards. All the provinces are supposed to have mental health review boards that are supposed to make sure that when patients are admitted in hospital institutions, it's done in a proper manner. I also think that that's where we also failed, because Gauteng has a mental health review board that it should not even be SASOP. They should have just said, you can't place patients in that facility. It's not good for them. These are the review boards where even if I admit a patient at Randfontein, the review board should come and speak for the patient and say, no, you can't admit the patient in this facility. The patient is well enough. They failed us.
Right. Do you believe that these families will have recourse? I mean, because it seems like on every level there hasn't been really accountability. So do you think that these families can come back for civil action against the Department of Health?
It will be out to the families, but I think there is a discussion about engaging on compensation between the families and the Department of Health, but I think it will be up to the families on what they do. But to me, there has been a lack of accountability at all levels of government on this issue, and I wonder if in the health system don't we have that kind of lack of accountability even outside mental health.
Okay, time is almost running out. Sasha, I just want to come back to you on one last question. I mean, this issue has really put mental health on the spotlight, especially in South Africa. And I think this topic is really not discussed amongst families, in our communities, and so, I mean, do you think there is enough done to conscientize people?
No, I think there certainly isn't. There's still a huge stigma associated with mental health. And if this tragedy can bring some attention to some of that stigma, some of the problems that exist in the system, and importantly to help us to come to some resolutions, some solutions for a broken system, then at least there's one good thing coming out of this horrible crisis.
Thank you so much to both of you. And that was question time for today. A big thank you to my guests and to you at home for watching.